Okay, well, good night, good evening. I'm Senator David Carlucci. Want to thank everyone for joining me here tonight. I'm still in the state capitol. We're negotiating the final touches on the budget that's due April 1st, which is today. So it's been a long few days. We're practicing social distancing. We're just in our offices and we're communicating through our computer. We're using Zoom to do that. Recently in the state legislature, we passed a resolution to allow us to vote remotely. So when we finish up this budget, I imagine that we'll all return to our districts and we'll be able to vote from our homes. So that means that the things that we don't get done in this budget, so many different issues that I'm hearing from residents in the community, that we will be taking up those issues and voting on them. The governor gave a talk today, the talks that he's been giving every day, and today he said that he expects that this session, this legislative session, will be one that is extremely productive. And I believe that's a good sign that we see the governor willing to work with the legislature, and together we're going to be able to achieve a lot. And we know that so many people are counting on us now to deliver. And that's why I want to make sure that everyone knows that even though our physical office is closed, the office remains open to you to call, to email, that if you have a question, a problem, you don't know who to call, please call me. And the phone number is 845-623-3627. And you can email me at, carlucci@nysenate.gov. That's carlucci@nysenate.gov. And our website is senatorcarlucci.com. That's senatorcarlucci.com. And some of the biggest questions we're getting is about unemployment insurance. We understand that unfortunately the lines have been busy when you call unemployment. However, you'll be able to backdate that claim to when it actually occurred. But we do ask you, if you're having a problem, to please contact me or any of the questions that you have. It's about us making sure we communicate. But as of now, we know the numbers have increased. We have over 83,000 positive cases in New York State. We have over 10,000 in Westchester County. And the latest numbers for Rockland County, we have 3,321 new cases as of today, April 1st. So unfortunately, where we are in the lower Hudson Valley, in Rockland and Westchester counties, we have some of the fastest growing number of positive cases per capita, per person, than anywhere in the country, and that would mean probably anywhere in the world. So we have to do our part. We have to practice social distancing, the proper hygiene, and that's what we can do. So please try to use social distancing as much as you can, because that will help us to flatten this curve. So with that, we're fortunate that tonight we have Leslie Cooper, who is with the Cornerstone. She's a primary care physician based with Cornerstone.
Nurse practitioner.
Oh, nurse practitioner. Yes, there we go. So a nurse practitioner, that's a primary care nurse practitioner with Cornerstone, stationed right at Jawonio, right there in Rockland County. And we're fortunate she's been busy all day, obviously, one of the many healthcare workers that's on the front lines. And what Leslie does, she works at Jawonio, particularly with people living with disabilities. And so she works with sees all types of things. And we thought it was great that she took a few minutes out of her time. She just got off seeing a patient, and she's on with us here at Facebook Live. So Leslie Cooper, thank you for joining us. And please tell us a little bit about Cornerstone and what you do there and the work that you guys do.
Okay, great. Thank you so much, Senator Carlucci. I really appreciate the invite and the chance to speak to you and everybody this evening.
A little bit about Cornerstone, what you do there and the work.
I work
Sorry about that.
It's Cornerstone Family Healthcare. We're a federally qualified health center. And I've been a nurse practitioner since 2010. I graduated from Dominican College at Orangeburg. And as a matter of fact, last week you spoke with my mentor, Dr. Stephen Klein, with Crystal Run. So I was very, very happy to listen to that town hall as well. So what happened was in 2017, I found out that Cornerstone Family Healthcare would be coupling and working as an Article 28 clinic or health center, actually, with Jawonio. I have a very soft spot for Jawonio because some of my best friends work here. One of my dearest friends is Diana Hess, and she is the chief. I think she does all the fundraising and things like that. So anyway, we were very, very excited that there would be an opportunity here for me. What I love about Cornerstone is the purpose of Cornerstone is to provide high quality. It's a nonprofit, FQHC, to provide high quality, comprehensive primary and preventative health care services in an environment of caring, respect, and dignity in a cost-effective manner that maximizes revenues to be responsive to the needs of the community that we serve, but with continued emphasis on the underserved and those without access to care regardless of race, economic status, age, sex, sexual orientation, or disability. And I know, David, you know the mission of Jawonio. It's not a lot different than the mission of Cornerstone. So it was a perfect marriage, and I am actually the perfect person to fill this job because it really speaks to who I am as a provider and what I wanted to do with my practice and how I wanted to treat patients, you know. So I just wanted to put that in a nutshell for you.
Yeah, no, thank you very much. And what have you been seeing? Obviously, you're on the front lines. What is it that is that's taking up most of your time now? And what recommendations do you have for people listening?
Okay, so the thing that I am seeing right now as a primary care provider, what has happened is that the care has moved outside of the health center, meaning that most of our triage is on the phone and our telehealth visits or telemedicine visits are being done through Zoom. I did one today through Ring Central. I do it through FaceTime. Any way, shape, or form I can get to see my patient and see how they're doing. That's what we're doing. The challenge right now that we're having is that being that I care for those that live in group home settings, it is very difficult to social distance people with disabilities, especially people that have developmental and intellectual disabilities who don't really understand why everything is happening and why they can't just walk around their house the way they're used to walking around, or and then you have people with neuromuscular disorders who, you know, that's a comorbidity that's very, very serious when you have a SARS COVID condition. So, you know, for me, the first thing that I'm always concerned about is pneumonia. They just don't have the muscular capacity sometimes because of spasticity or actually muscle weakness, you know, poor muscle tone. They don't have the capacity to move their lung. Their breathing is compromised. Therefore, their lung function is compromised. Many of my patients have COPD, you know, emphysema or chronic bronchitis. I also work with a lot of psychiatric patients, a lot of people with psychiatric issues. They do smoke, so I'm dealing with a lot of smokers as well. My patients the older patients have a lot of comorbidities. They're on a ton of medications. So it's been a very, very challenging on who to send to the hospital, who can I watch and keep home. Can I send them the azithromycin for possible secondary infection? So like a pneumonia, when should I send that in? Timing is of the essence. Somebody can have an oxygen saturation rate. So you figure 100 is the best. And what they're basically saying, according to admission guidelines, anybody who is between 91 and 94%, we have to strongly consider sending them to the ER. Possibly they can be admitted to the hospital, especially if they have rapid breathing, shortness of breath, things like that. You know, the only place for them to go is the ER. Just this week alone, I think I sent about 5 people to the ER just in the last couple of days. So social distancing, of course, it is the most important thing that you can do. I know that everybody's heard that a million times.
Right.
The
And that's a lot of
naysayers out,
comments
yes.
that we're getting is about social distancing and the needs, about what we can do to make sure that it's being fully practiced throughout every community. And what we've seen is, we know New York, it's really starting here, and it's going to be all across the country. Unfortunately, we've seen these predictive models. The Gates Foundation model is saying that something like over 90,000 people could lose their lives, and 16,000 here in New York State. So this is just a very, very scary, and it shows that we all of us have to do our parts. And I mean, you are out there on the front lines with your colleagues, and we commend you. Just like we have our soldiers that fight on the front lines in a war, you're doing that. And so, with social distancing, from your what you've seen on the ground, your expertise, what can you tell us about what we need to do, and what are the guidelines that just need to be followed? What's the common sense that needs to be followed, and what should the government be doing to make sure that that's enforced?
So, you know, as far as what the government can do to make sure that that's enforced, I don't think that Governor Cuomo can be any clearer in his messaging. Honestly, I feel that it's not what the messaging is; it's how people are taking it in. So if they're hearing conflicting views, then that is where, to me, that is the worst part of the problem. That there is this sense out there that somehow the media is overhyping things, that nurses and doctors that are in the front lines, real front lines, like in the hospitals, are overreacting. That why would they need so many ventilators, or why would they this? Believe you me, if I in 3 days sent 5 people to the ER, then you can just imagine in the next 3 weeks, when they're expecting this to triple, I will be sending 9 people to the ER in 3 days. I mean, and that's just my little practice. So I see so many people staying home. When I see people at the grocery store, and I have to tell you honestly, David, I mean, Senator Carlucci, I'm sorry, I don't go there anymore. I don't. My husband goes, because how can I take care of my patients if I am out in the stores? So my husband goes. He is the one, I make him wear a mask. He wears gloves, and he comes home. We leave our groceries outside. We make sure that we adhere to the 6-foot rule, so that you're not on top of somebody when you're waiting on the line. You just try to go shopping. You try to get 2 weeks worth of stuff if you can. Wipe down your house. I know that I don't even come in contact with that many people, and I walk in my door and I basically do not pass go before washing my hands and face, getting my scrubs off, because we're allowed to wear scrubs now during this time, and then, you know, making sure my room stays as clean as possible. But I have not gone out, and I am taking this very seriously, and I have been taking it very seriously. In the very beginning, I was asking my daughter, please wear a mask. I brought masks to them. Please wear a mask. You're in the subway, please. And they looked at me, Leslie, Mommy, it's going to be just like the flu. And I said, no, it's not going to be just like the flu. So,
Um, So, yeah, I mean, we've gotten a lot of the questions have been about that, about the concern, about how it's rapidly been growing in Rockland County, social distancing. And one of the things I want to point out is that there is a hotline that someone can call if they have concerns, they think that something is not being followed in the Governor's Pause Act executive order. And the hotline is 1-833 789 0470. That's 1-833-789-0470. A question came in, and I just wanted to address this. This is about, it says, uh, what can you share about why the governor won't allow schools to take spring break? We are exhausted as teachers and parents. And I appreciate that question because this has to do with the 180-day requirement to receive the full amount of state aid from the schools, from the state for the school districts. And I know my wife is a teacher, and I see it, and our teachers have been doing a remarkable job of doing the distance learning, stepping up to the plate. In little time, they were able to get up and going, and that is exhausting. Being on camera, communicating to your students all day long is an exhausting task. And I put in legislation right away after we knew that schools would have to close, that would allow for districts to still get the state aid without the 180-day requirement. Um, the governor put in an executive order and pushed to do it as well, but he said that you had to use up all of your snow days and vacation days before this would take effect. The legislation that I put in and worked with Senator Shelley Mayer, who's the chair of the Education Committee in the Senate, we put in legislation that would say, no, we don't penalize our teachers for this problem, and they would still get the break. Unfortunately, we haven't been able to get that to the governor to sign that legislation. We're hopeful there still is time in this legislative session that is a possibility to get that done. Obviously, that doesn't help when spring break is right here around the corner. But I appreciate the question, and that is something that many people and many of the teachers have been asking me. And I agree with you. I think not enough people recognize the hard work that our teachers are always doing, but particularly in this time where they've got to think outside the box to educate our children. So thank you for doing that. Let's see. Now, this is a question. Okay, the question about, let's see, 19 day. So, yeah, I mean, one of the things that we've been working on is trying to get more tests and to allow for our healthcare workers and our first responders to make sure that they're getting tests so that if there is a problem, that they know about it, and we can also circle through and get people on the front lines. Have you seen problems and any suggestions in terms of the testing, particularly for our healthcare workers?
yes. So in our practice, we're basically, I think I started out with about 10 tests, and I have just a couple more, and I do save them for the healthcare, my patients who are healthcare professionals. Um, it's a problem. There are a lot of people that are wanting to be tested. My very first 3 tests were done on people from the community who are not part of the healthcare field. And I just thought that it was my duty to provide, if I had the test, it was my duty to provide it. And then I found out that there's not enough tests. So we could not be a test site. We weren't prepared to be a test site like that. However, we do provide to our own patients. I found that places like Good Samaritan Hospital in Suffern are also giving the test to their practices. when we called BioReference to try to get more tests, and we called our administrative office, there's no more tests to be had. They're all going to the hospitals right now. That is where they are. There are not enough tests. There were not enough tests in the beginning. I think I'm of the belief that if we could have tested people, especially the caretakers, the direct service personnel, the nurses, the general managers of the group homes, the managers of the group homes, we may have been able to head off the growing spread of the coronavirus within our group home community. It's been very disappointing, to say the least.
Well, I think
I agree with whatever they say. that is not enough. Not enough. And when they were saying that there was testing, you can just go to Anthony Wayne. I went to Anthony Wayne, and they said to me, well, do you have a note from the doctor? And I said, no, but I'm a healthcare provider, and I performed a test, and I want to make sure that the PPE that I was wearing protected me from the virus, and I'm feeling run down, which was really stress related, and I did not feel well, and they did give it to me. They didn't really give me too much guff, but
I've got a bunch of questions about the Anthony Wayne testing center. That's exit 16 off the Palisades Interstate Park, and I got an answer today that because it's looking like a ghost town, people have said, but what they've done is they've changed the practice that they don't want people just lining up there, that they've really staggered the amount of people, the timing that they come to get tested. So they told me that as of today, 6,300 people have been tested at the Anthony Wayne site, and that's continuing on an ongoing basis. So that's good news that at least that's happening. But I think to your point, and I think this is the lesson that others need to know. I mean, we've been hit hard with it in Rockland and in Westchester counties. But for those around the country that particularly are in the field that, Leslie, that you're in, about the testing, about how you can really protect some of our most vulnerable residents. I mean, I think that is really something that needs to get out there, and we have to make sure that those best practices to say, hey, we were caught flat-footed. This is something that no one really could have anticipated in this magnitude. But we're here now, and now we have to learn on the fly, and we have to implement this now. So we can still implement many practices that will help to keep much of our community safe and mitigate the damages. However, there's a lot that other communities can do that it hasn't impacted them yet. And I think that's an excellent point about the testing. So it has to be made more available. This is another reason why we need to see the Defense Procurement Act or the Defense Production Act, that is a federal piece of legislation that allows the federal government to really order the private enterprise to start making products, whether it's ventilators, PPE, tests. Soon it could be a vaccine, or it could be other types of drugs that are we know are needed. So this is, please.
No, we need the medication. We need the medication. We can't just order Tamiflu for this. And this is, you're watching a time bomb every time you're watching a patient go through this. And that's how it feels. That I'm telling you the truth.
Yeah, no, and that's what we've heard from, and that's why I wanted you on here today to really tell people what you're seeing right there. And I know we watch it on the news and we see it, and unless you've seen someone that has really suffered with this, does it really resonate? But I think the numbers are getting through. At every level of government, people are speaking up and talking about what's going on. We had some good questions coming in. I mean, obviously the social distancing is a big issue that people are asking about the enforcement of how that's done. We gave the 1-800 number. Also, people can always call or email my office with any type of, if you see something, say something. Yes, we need to make sure that we are complying and we're getting the word out as much as possible. Well, the question was about ICU beds and what are occupied at Westchester Medical Center, Good Samaritan, and NYAC. I don't have those numbers in front of me. On Monday, we had the CEO of Nyack Hospital, Mark Geller. He was on, and he gave an update about what was happening in the hospital. I've been keeping in communication with Dr. Leahy at Good Samaritan, and she's been telling us about what's happening. But I do have the overall numbers for ICU patients in New York State. And as has been said, really what intensive care unit means in this idea is a bed with a ventilator. And so we have right now, we talked about it before, in New York State, we have over 83,000 positive cases. That's the most anywhere in the nation. Out of that, we have, out of the 83,000, there's over 12,000 that are hospitalized. And then from the hospitalization, the 12,000, we have about 3,000 patients on ICU. So out of the over 12,000 that are hospitalized, 3,000 are on ICU. And the very unfortunate news is that as of today, there's been over 1,900 deaths. It's actually 1,941 deaths in New York State. So that is extremely, extremely troubling and very sad. The good news is that there's been over 6,000 patients that have gone to the hospital that have been discharged, have been healthy enough to be discharged. So I wanted to bring those numbers up so everyone knew as of April 1st what the numbers are in New York State. A good question came in about how does a person know when they can donate plasma if they know they are COVID-19 positive. This is something that is very exciting to see, that there could be hope that people that have been tested positive when they are recovering, or when they're recovered, that they could be donating their plasma, and that could be extremely helpful. Do you have any information on that? Do you know about when it would be safe to donate plasma, how that works?
I don't know, because right now they're actually not even 100% sure when you stop shedding the virus. I mean, I think they went out as much as like 21 days, and they, people can still be shedding the virus, a very minuscule amount. But, and also, so it's very, I think it's a little bit hard to tell. And the other piece of it is, if we do contract the illness, does that confer to immunity? We're not 100% how long that would be. I'm sorry, I'm getting a call in the middle of this, and I keep getting.
Okay.
Well, I'm sorry about it. I don't know who to tell to ask them to stop calling me, but we'll work.
That's what happens. When it rains, it pours, right? I know you're busy seeing patients, so I won't keep you much longer. And I have to get back to the budget. I have a break right now that it worked out pretty well. But again, I'm here in the state capitol. We're going in and out of meetings to push along the state budget. It's been very difficult. There has been a drastic decrease in projected revenues. And we know that sales tax, as well as, what happened here? Okay. Sales tax has been pushed out for many small business owners. And we also know that income tax and sales tax revenue is going to be down. The governor's predicting about a $15 billion deficit, and no one knows the exact certainty of it. But one of the things that I wanted to make sure that everyone knows that I'm working on is dealing with property tax relief. In regards to, there has been an executive order about mortgage payments and about evictions from renters. And one of the things that hasn't been talked about is property tax relief, that when those property taxes come due, that it's a major, major strain for so many people in the Hudson Valley. In Westchester and Rockland, we pay some of the highest property taxes in the nation. So it's a real, real big issue. One of the victories that we were able to push that is already agreed upon in this budget is to make sure that someone that has a problem paying their property taxes, that the enhanced STAR property tax benefit is not taken away. What I found is with a regressive tax like property taxes, that if you can't pay it on time and you're hit with a large fee, that means you're going to be less likely to be able to pay that over time. So one of the pieces of legislation that we're trying to get done now would allow for, first, we lower the penalty for not paying property taxes on time. And then if you can't pay those property taxes because you've been impacted by COVID-19, that you would be able to defer those property taxes without penalty or interest. This is something that I believe is going to be extremely important in making sure that we protect our taxpayers in Rockland and Westchester counties and throughout the state of New York. And in doing that, that does help that we have to address the economy, because we have to make sure that people feel that they can stay home and they're not going to lose their home because of their job or something like that. And that's going to participate in the whole healthcare system. So we saw the analogy that the governor had used, and something that I really the analogy I like when we talk about healthcare is it's a chain, and a chain is only as strong as its weakest link. And that's why we have to make sure that around the state and throughout our region that each link is strong. So there's so much more that we could talk about, but I'll let Leslie, if you'd like to really to give us some words of wisdom. Thank you for taking your time. I know it must be exhausting in terms of what you've been doing, and thank you for taking the time with us. What would you like to leave us with tonight?
So the one thing that I didn't really do at the beginning, and I really wanted to say something about nurse practitioners. I don't know that everybody knows what a nurse practitioner is and what our level of education is. So I just wanted to read something. So a nurse practitioner is an advanced practice nurse who is a registered nurse with advanced education and preparation and holds either a master's or a doctoral degree. Nurse practitioners are licensed and authorized in all states to diagnose, treat, and prescribe. Nurse practitioners deliver primary and specialty health care. You'll find some in your hospitals as well, to all populations across the lifespan. Every quality study done to date supports nurse practitioners as high quality, cost-effective healthcare providers. We love working with doctors. We love working with other allied health professionals because we know that we're stronger together. Nobody can do it by themselves. Nobody's an island. We can only do it together. So my parting words is that I wish everybody strength. We need to persevere, and please lead with compassion. And that's it.
Well, thank you so much. You heard it, Leslie Cooper, nurse practitioner extraordinaire. It's people like Leslie that we're so fortunate to have. We're especially fortunate that she's working right at Jawonio in New City through Cornerstone, and that you're in our community. It's people like you that are giving us hope through this crisis. So thank you for doing that, and thank you to all the healthcare workers out there. There's been many questions. One of the issues is just about making sure that we really practice social distancing. We try to lock down as much as possible. That needs to be done. And I encourage people that if they have issues in terms of certain complaints, feel free to contact my office, to call the number that I gave out before for the state hotline. A suggestion was, can we have a town hall on how companies can navigate SBA lending and how small, medium businesses can secure emergency funding? This makes a lot of sense, and that's something that we're going to need to do. So I look forward to having a special town hall on that about having a SBA lending. And I just want to thank everyone for joining us tonight. I want to thank Leslie Cooper for being here. Thank everyone that's on the front lines and everyone that's doing their part to practice social distancing. Let's continue to do this, and if we do it together, we will be stronger for it. Again, I want to encourage everyone to call my office anytime, 845-623-3627. Go to our website, senatorcarlucci.com, keeping it as up-to-date as possible. And please sign up for my email news alerts so that you know about what's going on in the state and in our counties. Thank you for joining us. Again, I'm Senator David Carlucci. It's an honor and a privilege to serve you. Thank you.
Keep up the good work, Senator Carlucci. Thank you.
Thank you.